Hi, my name is Tehilla Brander. I'm the co-director of cancer genetic counseling here at Mount Sinai. One of the things that inspired me to pursue a career in medical genetics had to do with the opportunity to work with not only individuals but families. Genetics isn't only about one person, but we really think about how this impacts the individual, their relatives, and it's a really unique opportunity to support families and larger communities. Genetic research and technology is advancing so quickly, and so every year there's something new. On the one hand, there are newer technologies that have allowed us to detect new genetic causes for families who have been on a diagnostic odyssey. So, really finding answers for patients who have really been searching. And on the other hand, we also have a lot of clinical trials that target specific genetic diseases, especially here at Sinai. So, that's exciting to both be able to give people the answer they've been looking for, but then also offer them treatments and targeted therapies. One of the most difficult parts of working with patients and families affected with genetic conditions is really having to give people really difficult news and information that can really impact them over the course of their life. And so a lot of these conditions are also very rare and new, so there's may not be as much information about the condition and how it'll progress. And so genetic testing, counseling, and condition and discussing diagnosis with individuals can be a really difficult and nuanced conversation. Because every family and individual is so unique, we have really thorough and nuanced conversations with patients and their families. There is a lot of education about the condition, and it's also really important that we give them context and information about why we're thinking about certain strategies, why certain recommendations are being made, and it's really a joint decision process. So, empowering the patient to have the information they need to both advocate for themselves and make the best decision for themselves and their families. We also really work to facilitate care by making appropriate referrals to specialists, really acting as a quarterback for the family to make sure that they're being cared for in a lot of different realms, and connecting them to support both here at Mount Sinai or internationally and nationally. Because a lot of families affected by genetic conditions might feel isolated or alone, I think it's really important for them to know that here in medical genetics, we see you, we hear you, and we're here to support you. Um, because these conditions are so rare, a lot of times patients feel so isolated, their providers might not have heard these conditions before. But here in medical genetics, we have a home for you, and we're here for you.